Welcome back. This section of the show is called Ask FPA. You can send your medical questions to tv@fpalex.com and include your name if you would like for us to use it on the air. Tonight's question is, my son was diagnosed with depression and he's constantly on his phone. I think it hurts. What do you think? And here to help me answer that is Dr. Susan Monohan, who is an internal medicine and pediatrics physician, my partner at Family Practice Associates. Welcome.
Thank you. So screen time, phone time has become a really big concern for us recently as parents and also as medical professionals. Part of the reason for screen time is it keeps you from interacting with the real world. People are stuck inside their screen and aren't participating outside. They're not staying active, they're not keeping up with their schoolwork. It's a huge distraction from that. So what we really encourage is for limited supervised screen time. So for specific ages, the amount of time you should be on the phone, electronics varies with that. So
what kind of, is there an age specific amount?
So truth is, American Academy of Pediatrics really recommends no screen time until you're at least 2 years of age. So that means the little kids playing with the iPad, maybe not so good until you're 2. Between 2 and 5 or so, we really recommend no more than an hour. And then really, depending on as you get older, during the summer, during weekends, probably 2 hours is okay. But really during school nights, 1 hour is really enough.
Because it can affect a lot of stuff.
I mean, it clearly. There's so much, some of the pressure with social media, with kids watching different things, looking at YouTube, looking at different activities. They get kind of unreasonable expectations of what's normal, and they can also feel a lot of peer pressure in activities as well.
Okay. Now we're going back to school, so we always talk sometimes about exams and shots, but there's also other things. And you brought up I think, Sylvia, that's your daughter's backpack.
Yes.
So there are some problems maybe with backpacks or some recommendations.
Absolutely. So I brought this today just to kind of share with you. With the backpack, one of the things that we know or we have learned is that sometimes they put too much stuff in it, okay? And if they put too much stuff, it can actually cause problems with their shoulders and neck and can cause some back issues as well. So there's actually specific recommendations based on how much a child weighs. Should not put more than 10 or 20% of your body weight in a backpack. The other thing that's really important is that the backpacks have 2 straps. They have 2 straps for a reason. You really need to wear them on both shoulders. That pulling on one shoulder can actually cause a lot of neck and shoulder issues as well.
So you mentioned one thing, 10 to 20% of your body weight, but body weight is something we need to talk about too, because obesity in kids is a big problem. Absolutely.
So that's the other thing that we talk about for kids. Going outside playing. You don't necessarily have to do sports or, official school activities, but just going outside, running, being active, very important as far as trying to keep healthy body weight. Again, the recommendations are for about an hour of outside physical activity a day.
So it's important to pay attention to that, both for physical activity, cardiovascular, and weight.
Absolutely, absolutely.
All right. Any new shots we need to think about before we get out of here?
Vaccine recommendations have not really significantly changed in the last year. The only thing that I would recommend is if you have a young one that's going off to college, to make sure they've had that meningitis vaccine. That's a big push that we've really tried to do with our practice, is to make sure you're getting that meningitis vaccine.
That's great information, great help. So if you go back to school, watch your backpack, get some exercise, decrease your screen time. We'll be right back.